Hi, my name's Karen Gordon. I'm a physiotherapist and I'm currently working with the Arthritis Society. Today we're going to be presenting people getting a grip on rheumatoid arthritis, and we'll be talking about the benefits of low intensity exercise for people with rheumatoid arthritis. Does low intensity exercise help with people with rheumatoid arthritis? Has low intensity exercise been shown to be effective for people with rheumatoid arthritis? Yes, it has. It's been shown to be effective at reducing pain, and it's also been shown to be effective at improving functional status in patients with stable rheumatoid arthritis. We've chosen two examples of people with rheumatoid arthritis who can benefit from low-intensity exercise. Victor Peters is 48 years old. He's a garden center manager. He's been suffering with rheumatoid arthritis for 8 years, and he's been on medication for his condition. Although he had difficulty adjusting to it when it was initially prescribed, he's been taking it without any problems for about 5 years. Gus is 47 years old, and he's an assistant manager at this garden center. He also has rheumatoid arthritis and is very active with the Arthritis Society. He's taken our People Getting a Grip on Arthritis workshop, and he's learned some of the exercises that might help Victor. Victor started to do some of the exercises that Gus taught him, and it took about 3 months of training, but he noticed that some of his knee pain had improved. In conclusion, it's been shown that adults with rheumatoid arthritis of at least 12 months duration or 1 year duration who are able to walk at least 50 feet indoors can benefit from practicing low intensity exercise. We've chosen, based on the literature, a series of exercises that can be included in a low intensity exercise program. We've chosen 4 leg exercises that can be done in standing. These include mini squats, heel raises, standing side leg raises, and step-ups. The 3 arm exercises we've chosen are shoulder shrugs, the shoulder press, and arm curls. I'm going to be showing these exercises individually in our exercise workshop later on. The literature shows that low-intensity exercise practiced 3 times a week on non-consecutive days, meaning not 2 days in a row in the week, can be beneficial for patients with rheumatoid arthritis. It was shown that 2 sets of 12 repetitions can be most effective. Here are some tips that you can use to help make your low-intensity exercise program easier and more consistent. We recommend that you perform the exercises at the time of the day when you feel your best. For people with rheumatoid arthritis, this usually means avoiding doing the exercises first thing in the morning when you might be most stiff. It's also been shown that using a logbook or a diary to mark your progress are a good way to improve your motivation when you're exercising. Once you've learned the exercises and they're quite easy to do, you can try to do these exercises in front of the television or while you're listening to music. And finally, the most important tip we recommend is to find a friend or a family member to do the exercises with to improve your motivation. There's a few words of caution. Before you start the exercise program, we ask that you complete the physical activity readiness questionnaire. If you answer yes to any of the questions in the survey, we're going to ask that you consult your physician before starting the exercise program. The other recommendation is that you start the program when your arthritis has been stable. We don't recommend that you start the exercise program if your arthritis is in a flare. It's better to wait until your flare of arthritis has settled before you start the exercise program. Another word of caution, during the exercise session, try to avoid movements that increase your joint pain. And don't forget to take rest breaks if necessary. If you do experience an increase in your joint pain or any moderate or severe pain, stop the session for the day and wait until your joint pain has subsided before resuming. If a particular exercise is painful, you can skip that exercise and continue with the other exercises. You can either try that particular exercise later on in that day or wait until another exercise session. Today's presentation was mostly based on this study comparing high and low intensity exercise training in well-controlled rheumatoid arthritis. This concludes our presentation today on low intensity exercise in rheumatoid arthritis, and I'm looking forward to presenting the exercises individually in our exercise workshop later on.